let's talk about how to mitigate bias. Actually, more so, let's talk about how to mitigate discrimination, because I really don't believe you can mitigate bias when it comes to people living with obesity. I'm Dr. Sean Wharton. I'm an internal medicine physician working at the University of Toronto. So how do you actually decrease the impact, the negative impact that healthcare providers have with their patients who are living with obesity? The first step is to recognize that you have bias. You cannot mitigate your bias. You can't get rid of your bias. You have it the same way that you have prejudices. And how do I know that you have bias? Well, studies have been done where they look at preschoolers and they show preschooler a picture of a child living with obesity and a child with a disability. That preschooler will never choose the child living with obesity as a playmate. And they already start to attribute negative attributes to that child, such as their odor and how bright that person is. Clearly, these biases start very early and we grow up with them and we become adults who still have those biases. The issue is to as much as possible, avoid stigmatizing images and aspects that reinforce this bias and to not discriminate. So our job is to mitigate discrimination. Anytime you see a healthcare provider discriminating against a patient living with obesity, and what does that look like? It looks like a paternalistic approach to treating a patient, to treating them like they're not bright enough or capable enough to understand what the treatment options are. Waving your finger at them and lecturing to the patient. I told you about this dietary regimen. Why didn't you follow it? Or here it is again. Let me explain to you. As opposed to saying that you have a disease state, and in this disease state, if we treat it appropriately, you'll be able to incorporate all of the healthy living that you're looking forward to actually doing, that you actually know about already. That is where the discrimination lives. And we have many instances of that. Many healthcare providers are paternalistic. They act like a parent and they lecture patients. And patients leave their healthcare providers when they treat them like they are children. So let's be appropriate, compassionate healthcare providers and provide care for people living with obesity and not discriminate against them. Let's treat them like the beautiful individuals that they are.